Hey everybody, happy Thursday. Welcome back to another episode of Ask Kati Anything. I'm your host, licensed marriage and family therapist, Kati Morton. I'm so glad that you're here. In today's episode, we have a lot of great topics as per usual, but today I'm going to talk about having a dismissive avoidant attachment style, talk about what that is and how that can impact our relationship with our therapist. Then I'm also going to discuss how we can tell if we're doing something because we're depressed or because we're being lazy. And I'll talk about if being on antidepressants for a really long period of time can alter the way that our brain functions or can change our brain function. Then I'll talk about alternative treatments, things like magic mushrooms, ketamine, etc. And then finally, I'm going to explain whether or not our body can recognize stress in our life before we do. And I'll dig into how post-traumatic growth works. Okay? And if you're looking to get your questions answered, know that I do answer them over on my Patreon page at patreon.com/Kati Morton. Every month I have 2 different live streams. The first live stream is roughly about 3 hours every month. And that is when you're in the $20 tier and above, you can submit your questions. I put them together in a Google Doc and I get through all of them in a live stream. And then the second live stream, if you can't afford the $20 tier, do not fret. You can ask your questions live and we hang out for about an hour. And I get through as many questions as I can. Also, over on my YouTube memberships is another opportunity to get questions answered. In the $15 and $20 tiers, or I think it's actually 10 and 15, sorry. I have 4 live streams a month, 2 that are 30 minutes and 2 that are 60 minutes if you're at the highest tier. And I think that's $14.99 if my memory serves me. But you can go over there and get questions answered that way as well. But without further ado, let's jump into today's questions. Now, question number 1 says, "Hey, Kati, I have a dismissive avoidant attachment style, likely due to childhood emotional neglect, which makes me highly independent and even counter-dependent. I'm wondering, what can I do to foster a healthy attachment to my therapist? I've been seeing my therapist for years and she's great, but I still get nervous to share things with her. I don't want to get too attached, but I think I need my therapist's help with processing trauma. What should I do?" Now, the first piece here is to know that when we talk about dismissive or avoidant attachment, what we mean is that we have this really strong desire for independence. And this independence doesn't come out of the fact that we believe that we're best. It's more out of the fact that we don't believe we can count on anyone else. Like this person said, it's probably due to childhood emotional neglect, not having people show up when we needed them, right? And so we can even have a tendency to feel more comfortable being alone or prefer to know more about other people than have them know things about us. And so I just want to, at least make sure we're all on the same page with that. But when it comes to the relationship with our therapist, the best way to form healthy attachment is to talk about it with them. And I know it seems kind of weird. You're like, why would I talk about the attachment to them with them? Because this is the one relationship in your life where it's not this normal give and take of a relationship. You go to see a therapist, talk about your issues, they show up for you, they're there, and it's not about them, right? So we get to bring up all the shit that comes up in our other relationships with our therapist. And a lot of that will reflect in the relationship that we have with our therapist. For example, I would assume that this person who wrote this question struggles to connect with anybody in their life and might feel, again, better knowing more about other people rather than them knowing a lot about what's going on inside of themselves. And they'll also not want to depend on other people to do things for them. They can be kind of toxically independent, right? And think they're the only one that can do it because they can only count on themselves. And so because of that, and because we've recognized this, bring this up with your therapist that you get nervous to share. The truth about attachment, and I think kind of probably the key piece here, is the fact that when we're working to build or grow into a more secure place, meaning moving away from our anxious or avoidant attachment, whichever one we tend to have, for anybody out there, when we want to move towards a secure one, that means, unfortunately, we have to lean into the discomfort. When it comes to this, that means that when you don't want to share things and you get nervous, we want to push through anyways. But I know that especially when it comes to trauma, that can be too much too fast. And that's why my recommendation, in order to build and slowly grow a healthy attachment to your therapist, we need to talk about the fact that this is coming up. We don't need to push through necessarily and talk about everything. We need to let her know, hey, I want to trust you and I want to feel connected and I want to share, but I feel really nervous. And I'm sure it comes from my attachment and my concern that if I depend on you or if I count on you, that then you're going to let me down. There's probably a lot of work that we're going to have to do internally about that. We're going to have to find some ways to better calm our system down. Meaning if we get really queued up, right? When we start sharing and we start like connecting with someone and maybe counting on them for things, that can put us in what feels like a very vulnerable position, and we could find ourselves hurt. And that hurt can feel really dangerous, right? But we don't want to keep doing what we're doing, which is push everybody away, do it ourselves. So we have to find a way to calm our system down, to remind ourselves that we're okay, that we're trying something different, and to do it anyways, at least slightly, right? So maybe it means we share a little bit and then we change the subject. We can talk with our therapist about how to navigate this. We can say, I get really nervous and I kind of want to shut down, but I want to push through because I know this is going to be healing for me. How can we do this? Because it's going to be a little push-pull, right? You're going to have to challenge yourself. Your therapist's going to have to challenge you. And then we take a break and we try to calm our system down. And that means we're going to have some good coping skills on board that work for us, that help us feel, if not safe, at least neutral in our space, meaning not overreactive and not underreactive. Remember, overreactive is kind of like fight, flight, when we're taking action. Underreactive is when we're kind of dissociated, like we dissociated or we're in the freeze state, okay? And we want to bring it into this middle. And so we're going to have to find some ways to do that. That might mean we bring silly putty to therapy. That might mean we like start and stop when it comes to sharing. It might mean we spend more time just talking about the process of therapy and have your therapist explain what it looks like to have a healthy attachment to a therapist. All of that's going to be great, but take your time, because what we're trying to do here is relearn how to trust and count on other people. And for those of us with a past where people didn't do that, it's going to be really, really scary. And we're going to feel like we're putting ourselves in an incredibly vulnerable position. But this is the one place that I would encourage you to do it, is in therapy, because that's the safe place to do it. That's the healthy way to do it. We can ensure and know for pretty much certain that our therapist is not going to repeat what our parents did or what whoever traumatized us or hurt us did. They're going to guide us slowly into a place of safety, security, and feeling like it's okay to count on someone else. It's okay to trust someone with our deepest, darkest secrets. We can do that, right? But little at a time. And just for anybody wondering, what does a healthy attachment to a therapist look like? It looks like us not needing them 24/7. That's when we're kind of like anxiously attached, want to pull them close, and also not feeling like we can't count on them, being like, oh, I'm not going to share that because they're not going to be there for me. Those are kind of like the extremes, right? We need them all the time. We can't trust them, don't really want to tell them anything. We want to be somewhere in the middle where we maybe look forward to our session. We're like, oh my God, I got so much to share with her. I cannot wait to tell her and get her perspective on this. We look forward to our sessions. We enjoy them. They're probably hard, but then when we're out of session, we can think about our therapist and everything, but if there's no obsession, there's no urge to reach out all the time. We can regulate on our own. That's very healthy. And if we find ourselves needing them all the time and not being able to regulate on our own, that might mean we need a higher level of care. And there's nothing wrong with that either. But this healthy attachment means that we don't like yearn for them in between session. We also don't feel like we can count on them, and we don't really let them in on what's truly happening. Those are kind of the more anxious or avoidant attachment styles. Does that make sense? I hope so. But let me know if you have follow-ups, okay? Quite a few comments on this. The first one says, what if it's not as much about getting too close, but being judged by your therapist? I know therapy is not a place for judgment, but I can't seem to get myself to believe that. I've been in therapy for a while now, but I still get so nervous before each session. As a result, I find myself sort of shutting down and not being able to tell my therapist what's actually going on. The thought of someone getting that close to me is really scary. For context, I'm not great at vulnerability in general, and I usually keep people at a distance. I have generalized anxiety disorder, depression, and some disordered eating habits. This is also incredibly common. And I guess the way to figure this out is, obviously, you guys know I'm going to say, bring it up with your therapist and tell them that this is happening. But more so, I know your therapist is going to first check in to see if there's something that they're doing that's causing this, because I've had patients tell me all sorts of different things in the past, like, oh, I don't really like it when there's too much eye contact, if you can give me breaks every so often. Otherwise, I feel kind of judged. Okay, fair. Or, my mom used to always cross her arms. And even if I'm cold, like if you're cold, I find you doing that, that's very triggering. Like I've had people tell me all sorts of things. I actually had a patient in the hospital tell me I blinked too quickly. That was interesting. But you can tell them anything. You can tell your therapist, hey, I'm worried that if I tell you things, I'm going to be judged. And the thing that after checking in to see if I'm doing something, the next place I'm going to take it and where I'd encourage you to start thinking is, where have we felt judged before? And you might be like, my whole life. Okay. So what was a good relationship or a close relationship you had where you felt judged? Like an important relationship, maybe one with like a best friend or a parent. Were any of those places where you felt judged? What did you used to do when you felt that or experienced that? What do you think judgment from your therapist would look like, right? We're going to have to get to know this a little bit, understand better where this automatic thought of like, I'm going to be judged. If I share this stuff, I'm going to be judged, where that's coming from. Also, as a flip side, a lot of times things happen to us when we're younger, where we felt unaccepted by our parents. Maybe they were super strict and rigid and everything had to be just perfect. Maybe we never felt like we fit in or that we weren't good enough, right? If we didn't get straight A's 100% on everything, our mom or dad was just like, oh, you're not good enough, right? We got that message. So maybe that happened when we were growing up. But now we also have to recognize, and there's this big piece as we get older, where I feel like we all need to recognize that we're continuing to engage with that in our own life. Meaning, yeah, my mom, let's say, talked shit when I was growing up. And so I always thought I wasn't good enough. But now I talk shit to myself, almost like in my mom's voice. Continuing to put myself down, continuing to judge myself, continuing to perpetuate this belief that I have to be perfect in order to be loved or accepted or whatever it is, right? We need to dig into this and like get to know where this concern over judgment is coming from, because I'm sure you felt it before. We're not making this up. This is something you've been dealing with internally, externally, maybe for your whole life. And obviously you said, therapy is not a place for judgment, but the thing about it and the truth probably is that you haven't experienced a non-judgmental space before, or one that you could at least recognize as non-judgmental. And so it's going to be slow and steady. I'd let your therapist know this. Again, like I said, their first reaction is going to be to make sure that they are not doing something that's causing this straight up, like, I don't like it when you do this or that. If there is something they're doing, you can tell them. It's again, our feelings aren't going to be hurt. But then the second is going to be trying to figure out where this is coming from, where it's happened before. And it sounds counterintuitive to like go backwards and around versus figuring this out so we can just talk through things. But if we don't understand it, we can't get rid of it. We have to better understand where this judgment's coming from. What is the voice that we're hearing? Is it our mom's voice, our dad's voice? Is it our own voice? How can we untangle that and get ourselves to a place where we are then able to share in therapy and not have that weighing over us or hanging over us? Now, we can push through a little bit and slowly prove to ourselves that the judgment isn't coming. For example, if we always are afraid to share about these certain items, let's say disordered eating habits, we're afraid we're going to be judged. If we share a little bit about it, we can see how our therapist responds and take that as information as to how or if we're safe to share more. You know what I mean? Almost like proving to our brain that it's okay to share, that this is not a place of judgment, because we can know it, but we haven't experienced it. So that's another alternative. But I hope that kind of gets you through, pushes you on. We have to understand things before we try to get rid of them. We can't just, it'd be so nice if we could just be like, you know what? I don't want to have a fear of judgment anymore. So I'm going to work on that. It's really hard to, even as I say that to you, it's like, I don't know what the first step is, right? That's why we have to understand it more so we can untangle it. Does that make sense? I hope so. Okay, next add-on says, I struggle with the same. Also, when speaking about sexual abuse details, I'm so scared that she will feel disgusted. I always tell her to tell me if it's too much, but she always answers it's okay, that she's used to it. We are. But it's really hard for me to believe it. Would you tell a client to stop describing disgusting details if it was too much for you? Yes, if I couldn't hold the space, I would let you know, and I'd also probably get into my own therapy, because being a therapist, trust me when I tell you, we've heard it all and seen it all. And you would visibly see it on us, and we would tell you. Your therapist is saying it's okay because she can hold that space for you. The fact that you are you worry she's going to feel disgusted speaks to the fact that you probably feel disgusted by this, or you've been shamed or blamed for it in the past. And I'm curious, again, where that belief comes from. Just like we're talking about the other person, like judgment, yours is judgment and disgust is the outcome. And I'm wondering where that comes from. We can challenge it. But yes, your therapist would speak up and let you know if it was too much, or if they thought you needed a higher level of care or someone who was more specialized. But so far they've told you that it's okay. You can keep sharing. And like I've said, we've seen it all. We've heard it all. It's our job to hold that space so you can dump all the things that are hard to talk about elsewhere. So it sounds like your therapist is good. Hang in there, okay? Another add-on says, I had the same fear of getting too attached to my therapist. And after 3 years, I thought I'd managed to overcome this fear since I knew I really needed to heal. I felt I could trust my therapist, even though my head told me so often to hide away. I pushed through, but now I'm just confused. I revealed myself in ways I never did before, but as I opened up week after week, I felt that my therapist was growing distant, as if the connection that is so hard to describe that we had slowly faded away. Right now, we don't agree on the way to work together. Interesting. I just can't do what she wants me to do. I can't stop thinking that I'm letting her down, but the truth is probably that I feel let down. And this is so hard to admit since I don't think I deserve to care like that. Because I can't meet her expectations, and every session is mostly just a painful reminder of it. Oof. I think I might need to let her go. She even suggested that we take a break. She thinks I'm not ready to work on myself, but I feel that we're sadly not on the same page anymore. It broke something in me. As I opened up, I realized what were those things that I felt I needed to work on. I'm aware that I still need support, even though I would prefer to make it all by myself. Of course, we can be toxically independent, right? That attachment we talked about. Any tips on how I could move on to a new therapist and open up again? Wow, I feel awful even writing this, since there is this part of me that listens to my current therapist and tells me that I just don't put in the effort. Ooh, could she be right when she tells me that? If I have such a response, it's because deep down, I just don't want to get better. Is it likely to always be the same with any therapist I work with? Maybe I don't have what it takes to take part in such a relationship. Could it be that? I don't know what to do. Okay, there's one more add-on after this, but that's a great question. And the truth is that, I have a lot of questions on top. Like when you said you and your therapist aren't on the same page anymore, what does that mean? Because I'll give you examples of times when I have felt like my patients aren't ready to do the work and maybe need to take a break from therapy or see somebody different. That looks like them lying to me about their progress. And I'm not offended. It happens all the time. Lying to me about their progress over and over, not being able to do the homework for whatever reason. And we've tried like lowering it to basic need things. We've tried changing it. We've tried using a workbook. We probably tried a lot of different things, but the homework's just not coming through. And then the third and the biggest piece is usually when my patients aren't ready to work on stuff and aren't, moving forward on things. They also start showing up late to appointments or not really participating in session very much or canceling last minute, all sorts of stuff like that. And so those are all the reasons that I might feel like, oh, maybe we need to take a break, and you can reassess and then come back if you feel like you're ready to work on things. I'd also just want you to know that if I was to say that to a patient, I have to be very cognizant of the words, the language used to let them know that I'm feeling that way, because I don't want it to be judgmental. So the way that I usually say it is, it seems like a lot of what we're working on is too much for you right now, or you're maybe not interested. Is that true? I'll always check in with them. Do you feel like that's correct? What's going on? Or like if a patient said, I wasn't able to do homework, or more often than not, they tell me, sorry, I stuttered there. More often than not, they will tell me, oh, I did it. And then when we talk about it, they're like, I actually lied, I didn't. Or they'll have like their parent come in or their spouse or a roommate, and they'll tell me that they're not doing it. And so when that happens, and I'll say, what's getting in the way of you being able to accomplish it? Is it too much? Or, we have to figure out what it is. There's no judgments here. And I just wanted to talk about that kind of as a whole, because I feel like the way that your therapist potentially said this to you, because I'm just hearing from your perspective and I don't know exactly the language used, but it seems kind of hurtful, a little judgmental. And I'm so sorry that you're going through this. And so I'm not sure what her expectations are, but it seems like she's moving too much too fast for you. and maybe the pacing's not right. And that's kind of what I would say to her. But your real question, so sorry, I got off on a tangent, but I just think it's important for us to know the reasons why a therapist might say that, how we would say that, and how we'd navigate it. Because that can happen. We cannot be ready to work on stuff. That doesn't mean that we won't get better. It just means right now is not the moment when we can do this. It could be for all sorts of reasons. We could be stressed with work, or we could still be living with the abusive person. It doesn't feel safe to talk about this stuff. Or we could still, be on the fence about whether or not we want to get better. Those are all valid reasons, right? It's okay to take breaks and come back and when we feel like we want to do the work and we're ready to. We don't have to want to get better. Also, I want to throw that out. We don't have to want to get better in order to participate and benefit from therapy, but we do have to not like how it is and be willing to consider doing stuff to change that. That's really where it's at. A lot of my eating disorders patients especially will be like, but I don't really want to recover. And I'm like, you don't have to want to, and you probably won't for a really long time. You just have to not like where you're at. That's all. Okay. I think that's important to make that distinction. But actual questions here were any tips on how I can move on to a new therapist and open up again? I would encourage you to take some time to recognize the fact that you did open up with this therapist and what that process was like and how it felt for you. Let's reflect back on that. Sometimes I feel like when we're thinking of switching over and transitioning, we want to go back to exactly kind of where we were. We want to feel like, I have to start all over. But no, we've grown, we've changed, we've done this before. We can do it again, right? We have a history of opening up and it being okay. So let's reflect on that and how that went down, how it felt, how you managed it, all the while reminding yourself that you did it. And it was beneficial for a long time. It's not anymore, but it got you through a lot. That's how I would attack that, okay? Other question is that, could she be right when she tells me that I have such a response because deep down I don't want to get better? Only you know the truth about that. And the fact that you're still wanting to go to therapy and you're considering seeing someone else tells me that maybe this therapist took you as far as she could take you. Sometimes I see therapy as like a relay race. We start with one therapist who gets us to open up and feel okay, and we can actually talk about stuff. And then we're like, oh my God, I guess what I went through was trauma. Then we look for a trauma specialist, and our therapist passes the baton to this next therapist who's more specialized. And then maybe once we're done with the trauma work, you're like, you know what? I really need some more attachment stuff because this is like what's messing up my relationships. That therapist passes the baton. It doesn't always have to be that way, but it can be. And I think that's very normal. I even have differences, not in so much of specialties that are needed, but different needs that I have in my therapeutic, adventure, pathway, route, right? As I'm on my life journey. Sometimes back in the day, I needed more of a mothering type therapist because my dad was super sick and he died. I needed a place to feel cared for. And then once I've kind of worked through that in the grieving process, and I was going twice a week, and it was just, I needed a lot of support at the time. After that, I kind of wanted more tough love. And so, switching over into that. And then I did parts work and I did some EMDR because then I lost my grandma, my papa, my aunt, and my uncle all in 3 years. I just felt overwhelmed by it. My needs can shift and yours can too. And that's okay. So I don't believe that you just don't want to get better. I believe that maybe this isn't the right fit, but be honest with yourself. It's okay to consider where we're at and what we're ready for. And then the last little bit of your question, you said, is it likely to be the same with any therapist that I work with? Maybe I don't have what it takes to take part in such a relationship. Could it be that? Maybe. We won't know if it's going to be the same with any therapist we work with until we really think about this. Like I said, reflect back on your work with this therapist. How did you get to where you are, and how did you end up on different pages? Let's assess. Because we all have our own role in therapy, but also therapists have our own limitations, right? I don't specialize in addiction. I can handle people who have addiction, but that can't be their primary focus. It can be I've been in recovery for so long. If it's active and it's the main symptom, that's not my specialty. I would refer them out. I have great colleagues who work with that, or autism in general. It's not my specialty. I can manage and I can upkeep with, depending on what people have going on in their lives, I can continue that, but I'm not going to be the one to set that treatment plan and start that because it's just not my specialty. So I might refer you out. So there are limitations as to what a therapist can help with. And maybe this therapist was good with the first piece, but isn't good with this other stuff. Or maybe your needs have shifted. So just reflect on this and see where you think it's coming from. Because if it just feels like it was a good fit and now it's not, that's okay. That happens. That doesn't mean you're going to bring it into any relationship with every therapist. I find that to be more common when it comes to like attachment stuff. When we feel like super attached, like we want to kind of put them in that void in our life that we feel from like our mother or father or whoever wasn't there. That's the stuff we tend to like take along no matter where we go. But this sounds like it just might not be a good fit anymore, but take some time. I can't tell you if that's going to be the same no matter what, but I can tell you, how to figure that out. So report back. Okay. Now the final add-on, it says, how can we bring up our attachment with our attachment to our therapist with our therapist? I've come so far with my therapist and worked through a lot, but there are some things about our relationship that are confusing to me, and I don't know how to bring it up to her. I have disorganized attachment, and some of the energy and communication between us lately has really affected the push and pull. Interesting. And I'm constantly missing her in a way that leads to a decline in my mental health, or wanting to quit therapy and ghost her. Push pull. Although I think my desire to ghost her mostly comes out of the fact that I want to know if she'd check in on me if I really stop reaching out to her. Ooh, I hate it. I totally feel that. I don't know how to work through it or start the conversation about it. The truth is, we can do a little recon on our own, okay? What is it about? Because you said that you've worked through a lot together, but some things about your relationship are confusing, and some energy and communication between you lately has affected this push-pull. It's like triggered it. Could you get more detailed about that? What is it that's happening that is triggering this response? Because we're going to take that information that we understand about our interaction with our therapist, right? We're doing our own internal research. What is it that triggered this feeling in me? Then we're going to go to her and we're going to say, hey, I've noticed my attachment stuff has gotten like way more intense. I used to have a patient who would do this all the time. She'd be like, I wanted to call you like 12 times in between sessions. I need to talk about this. And that's how she'd open it up. Obviously, we'd had like a zillion conversations about this, so it was a much more natural conversation by this point. But even at the beginning, she would reach out a lot in between sessions, and then I would bring it up in session. So your therapist might bring it up, but I encourage you to bring it up. But when you know more about it, when you're like, hey, this, that, and the other, I think triggered this reaction in me, all you have to say is that. Like, hey, I noticed sometimes when we communicate and you use words like this or that or whatever it is, like I care about you, I worry about you, for some reason, that response or this communication style or whatever it is, right, has triggered my attachment stuff. I don't know why. And you can even say like, I'm embarrassed about it, or it makes me feel crazy. My patient used to say it made her feel crazy. But you can use whatever language feels comfortable for you, but that's how we bring it up. If we have a little bit of information about it, understanding a couple of the triggers, that's really helpful for your therapist, because the truth about it is, as weird as it sounds to say it this way, it has nothing to do with your therapist and everything to do with the attachment and the wounds that we are, getting into, shining a light on, right? And like better trying to understand. And so once she knows that, then you can start working through it. So figure out what some of the triggers are and then bring it up like that if that feels comfortable. Obviously, you can put your own language to it, but I find that to be really effective. Like, hey, we've done X, Y, or Z together. I don't know what it is, man, but that is like triggering some of my attachment stuff. And I'm really embarrassed, or it feels really icky to me. I want to figure this out. I don't like this feeling. It's okay to say that. If that's all honest and true for you, that's how you could bring it up too. Okay? Keep me posted. Let's move on to question number 2. And it says, hey, Kati, my psychiatrist tells me that I have a strong internal locus of control. I haven't heard this phrase in a while. It's a very therapeutic, like in school, we learn about the locus of control. Essentially, when you say you have a really strong locus of control, that means that you believe that it's like all your actions have like a ripple effect, almost like I have complete control over my own life and actions. Like I feel completely autonomous, which is great. And we should all have an internal locus of control. But sometimes when we have too strong of a locus of control, it can bleed over. And we'll get through the rest of this question and you'll see how it's like bleeding over. So I have a strong internal locus of control that I tend to attribute everything to my own doing. So you feel like everything's under your control. My question is, I'm not trying to let myself off the hook sometimes, but I have trouble differentiating when I'm not doing something because of my depression and when I'm not doing something because I'm just lazy and letting myself off the hook as an excuse. I feel like I may just go to the complete opposite and let myself get away with everything when it is really just my depression brain telling me not to do stuff and will ultimately make everything worse when I realize it later. As an example, I went from working crazy hours and burning out to not being able to produce any work and not being able to focus at all. I either get distracted at the tiniest thing or I just fall asleep 5 minutes into doing any work. Thanks for all that you do for providing this platform for us to ask questions. Of course, happy to. This is a great question. And my knee-jerk reaction to this is that this is all depression and you're not lazy. Something to always remember. I don't know if this resonates with you, but it resonates with me. I saw this meme many months ago that said, if I was being lazy, I'd be enjoying myself. Think about it. When we're being lazy, we're usually just judging ourselves because our depression is making it impossible for us to do anything. So if you were being lazy, you would be enjoying yourself. Think of it like lazy Sunday, lazy Wednesday afternoon. Those are things we relish. We roll in. We feel it. We love it. Nice lazy day. Not this. This is judgment. I'm lazy, letting myself off the hook. That is not what that is. This is depression. So, keeping that in mind, I believe this is all coming from your depression brain and your depression symptoms. And I would let your psychiatrist know that this is happening and that maybe we need a change of medication or we need a different strategy because, yes, you can believe you have a lot of autonomy, right? A strong internal locus of control. So you attribute everything to your own doing, which is why you judge and think that you're being lazy when it's your depressive symptoms. But clearly the depressive symptoms are still there, right? And we only know how to numb out and like work really hard. Like we swing in these extremes when life is more in the middle. And so I really believe that we need a better treatment for our depression because you only know how to live in the extremes. And that's probably because your depressive symptoms are so strong that if we let them take over, we can't do anything. We fall asleep. Like you said, you can't even focus. And other than that, so we do that, or we like white knuckle and we just push ourselves through, like you said, working crazy hours and getting burnt out. We don't really know how to do anything in between, which the therapist to me is like, your medication's not doing what it needs to do. And you said it's your psychiatrist. So I assume you're on some antidepressant or something like that, but let them know that we're still feeling like this. The depressive symptoms are really strong and see if that can get you a little bit of breathing room to figure it out and to figure out what it would look like to be in the middle, to not be working crazy or not working at all, right? But that's why we tend to swing between those because we only know how to white knuckle it and then we get really exhausted because we can only do that for so long. And then we lay into our depression, right? Because it lures us in. Yeah, those are my thoughts on that, okay? Let's move on to question number 3. It says, hey, Kati, thank you for all that you do to help others heal. Of course, it's such a privilege to be a part of anybody's journey. It says, my question, I've been on antidepressants since I was 19 and I'm now 47. And my entire life is completely different as it once was growing up. Obviously. Is it possible that staying on antidepressants too long may change your entire brain function? It's a great question. Will I have to depend on them for the rest of my life? I'm afraid that I've been on them so long that I may not know who I really am, and this bothers me. Okay, a lot to unpack here. First of all, antidepressants aren't going to alter your brain completely. However, they do trigger certain things and have certain side effects as a result, okay? Meaning that depending on what medication we're on, also, when you see your psychiatrist or your medical doctor, whoever's prescribing your medication, because I am not a doctor, ask them about all the side effects. Ask them about any withdrawal symptoms. Ask them about stuff like this, okay? Because overall, what I would call newer age antidepressants, from the Prozacs to the Zolofts to the Paxils to the Celexas to the, whatever it may be, they trigger our brain to have an affinity for certain, so the medicine comes in, it'll have an affinity for a certain receptor site. So it's almost like it's attracted to it in a really strong way and it gloms on. I love the dopamine receptor. It attaches to it. What that does is then it looks for dopamine in its space and like pulls it in, helping us feel better. Because without that, it's almost like maybe our brain doesn't have enough of the dopamine transporter. So even though it's floating out there, nothing's bringing it in, helping us like absorb it, for lack of a clinical or scientific term, and feel the effects of that reward type of chemical/hormone in our brain. Does this make sense? So when we have a medication on board for a long time, we can experience things like poop out where it just stops working, but our brain also is still just doing its regular thing. This medication has come in and glommed onto certain receptor sites and certain parts of our brain to help them suck up more dopamine or serotonin or norepinephrine or whatever it is that we're looking for. And we'll become accustomed to it. Now, I don't know fully, again, I'm not a neuroscientist, I'm not a neurologist, I'm not a psychiatrist. So I do not know if there are specific medications. I would assume that some medications long-term could, if they have side effects or things that are happening, it could affect us in different ways. That's why it's really important that you ask all those questions. But as far as I know, long-term treatment on an antidepressant isn't a bad thing. It doesn't change our brain function. We can try to titrate down and see how we feel, but we've grown accustomed. I think it's more about us growing accustomed to the way that it feels to be on it. Now, I have had patients, I'm just going to share a couple examples. I have had patients who've been on antidepressants for, let's say, like 5 or 6 or maybe even 10 years, and they lower down their dosage and start feeling their feelings more, which can be uncomfortable. But if they have tools on board, if they've been working with me or with whoever their therapist is, then they can figure out how to manage that. And it can feel really empowering, and we can actually feel better. And it can reduce some of the, maybe side effects, like sexual side effects, like not enjoying sex the way that we used to, or weight gain or sleep disturbances or nausea or whatever. So we can always attempt to go off as long as we're doing it with the guidance of our psychiatrist or our prescribing doctor, because there's withdrawal. I've heard from a lot of you, I think is it Celexa? You guys let me know in the comments if I'm wrong. For some reason that doesn't quite sound right, but maybe it is Celexa. But there's a lot of withdrawal symptoms. We have like headaches and even brain fog and brain zaps, which can be really, really uncomfortable. So some of them do have intense withdrawal symptoms. And so we just want to talk to them, our doctors, and make sure that we know what we're getting into and do it slowly but surely. But it's not changing your entire brain function. You're not going to be ruined for the rest of your life. It's not like you don't know who you are, but there are going to be these pieces of you or of your life experience that could feel numbed out. That's what my patients would tell me, is like, hey, I feel like I've never been able to experience the full breadth of life because I've had to be on medicine, because if I wasn't on it, I was suicidal, or, I was super depressed or super anxious, right? And so we might be missing some emotional nuance, and we might want to get that back. And there's nothing wrong with trying to go off and seeing how we do. If our symptoms get worse, we can go back up. That's happened with a lot of my patients. It's gone where they can go off completely, and maybe they only need to be on it a couple months out of the year, if anything. And others of mine that we went down, we should go back up because the symptoms returned. We just have to be aware and be tracking our emotions. You can ask your therapist or psychiatrist if they do have like a mood tracking app that they like, but I would encourage you to do that if you're going to try to take them off, because for some of us, we will need to be on medication for the rest of our lives, just like anything. If I have high blood pressure or high cholesterol, if I can't manage it with my diet and exercise, then I might need to be on that medicine for as long as my doctors recommend, right? And no different with our mental health. But if we're able to manage it on our own, if we have tools now that we didn't have before and we feel like we can handle it, then we probably can. You can give yourself an opportunity. And I don't really like the word depending on them, but if they're keeping us alive and they're keeping us feeling okay, then we should have them, right? But there's nothing wrong with trying to go off of them every so often and just seeing how we do. Unless the suicidality is really intense or the mental illness symptoms, like some of my schizophrenic patients or bipolar patients, I wouldn't encourage them to do that because the symptoms can come back so strongly and really detrimentally affect their life. But if that's not the case for you, there's nothing wrong with trying and seeing. And that can give you an opportunity to see if maybe there is something or some part of yourself that's a little numbed out. But that's why it's so important we have these conversations and we feel like our treatment, that we're part of our treatment, that we're not just being told what to do. Because if you've been on antidepressants for so long, There's always a part of me that wonders if there has been poop out. It doesn't happen with all medicines, but it can. And maybe we'd be surprised we go off and there isn't any issue, right? Maybe. But talk to your doctor. Know that it's an option. If they say it is, ask all the questions, ask about withdrawal symptoms, and do it according to what they recommend. Because they might have you lower the dose a little bit for a month. We'll see how you do. Then we lower it again. And this will prevent any withdrawal and also any like backlash of symptoms, like all of a sudden feeling your depression, like whoop. It'll keep you safe. Okay? So I hope that answers your question. Now, moving on to question number 4, says, hey, Kati, I recently had a breakthrough with magic mushrooms. The research on psilocybin, that's the active ingredient kind of within magic mushrooms that make them, quote unquote magic. The research is amazing for treatment. I cannot encourage you, if you have it in your area, to look into it. Usually one of the research like organizations is called MAPS, MAPS. So you can see if it's available in your area. It completely stripped away any thoughts I had about myself, and I was able to forgive and have self-compassion towards myself. Amazing. It's been helping me work through my traumas in therapy. I have major depression, CPTSD, and anxiety. Can you please talk about all the benefits of ketamine and mushrooms? And can you talk about your thoughts on the integration of therapy and psychedelics? And then there's a comment that said, to go off of this, can you talk about alternative treatments other than typical medications like lithium or Spravato, which is an inhaled medication? You spray it up your nose. Like, have you had clients use these in the past? Are they really safe, etc.? Okay. A lot to unpack here. There are so many benefits to what I would call alternative treatments. Everything from ketamine to psilocybin to even MDMA they're doing research on. Also, things like the vagus nerve stimulator or basal ganglion block. And this might just be this is my own opinion, first of all. I want to throw that out there, but the research, I cannot encourage you enough to look into it for alternative treatments. The research is super strong. And I'm very excited about where things are going, especially things with like psilocybin, ketamine, MDMA. And I assume there'll be stuff with like different strains of, marijuana, because we have a ton of different options nowadays, right? I'm really excited to see where it goes. The reason I get excited about, especially things like, mushrooms or even marijuana and things like that, is that they're not I'm sure they'll make them as processed, but there's always a part of me that's like, when it comes to pharmaceuticals, the more natural, the better. Because our bodies are more made to engage with more ease with natural things. It's not to say that there isn't benefit from the unnatural either. I'm just saying that I'm like, why don't we try that first? If it has like the least amount of side effects and doesn't interact with anything poorly, I think that's always a win. And unfortunately, a lot of like drugs, quote unquote drugs, like we call street drugs or party drugs, have been thrown into that category. And it's nice to see them being researched now, because they exist and people use them for a reason. And if we can utilize that to benefit those of us with mental illness, that's amazing, right? But asking all the questions, again, is super important, making sure that you're informed and you feel like you're making a good choice for yourself. But the thing with especially psilocybin in particular, because I've actually probably read the most research about it. I have to be honest, I haven't read a ton about MDMA or ketamine aside from the approval of Spravato, which is that nasal spray that has ketamine. But when it comes to psilocybin, the thing that I've heard time and time again, not just in the quantitative research, meaning like the numbers of it, like, oh, it improves symptoms by 5%, but in the qualitative, like in the interviews they did with people, a lot of people will talk about it, that it like allowed them to think more clearly. It took the weight off their shoulders. Their hypervigilance was down. They were able to see themselves in a different light, feel emotions and wander through experiences that before were too triggering, too overwhelming. It's almost like it removes a little bit of our, like emotional hindrance maybe, or maybe part of our like stress response can be minimized. It just, the interviews that you hear from people are really amazing to read through. And that's actually what I find to be, I guess, the most informing for me. I can read like statistics, be like, oh, it's statistically relevant and wow, it's really doing stuff. But I want to hear from people. And so I'm glad you had a breakthrough. I've heard that time and time again. My good friend, Dr. Alexa Altman, has done a lot of research in this space, and she cannot be more excited about it. Every time I talk to her, she talks to me about it. I think it's amazing. I really believe ketamine in particular. So now we're going to switch out of magic mushrooms, going into ketamine. The research on that, again, I've read some, but not as much as I have about psilocybin, but they find it to be incredibly beneficial for those of us who have what I would call like treatment resistant suicide. Like our suicidal thoughts just will not go away. They bother us all the time, no matter what. We can feel not so depressed, but the suicidal thoughts remain. Ketamine has had great improvement in that space. There are different ways you can do it, whether it's intravenously and you have to go get the infusion. That means somebody has to drive you home and you're out of it for the rest of the day a little bit. And it takes some time. It's like 30 to 45 minutes, I think, to do the whole infusion. But then there's things like Spravato, where it's a nasal spray and you inhale it and it has ketamine in it. And, you have to take it as your doctor prescribes it. But those have all been incredibly beneficial. And in general, I really feel like we need to get out of what we always do, like SSRIs, SNRIs, because those have taken us as far as I think they can. And I know people might disagree, and I'm sure there's shit tons of pharmaceutical companies putting research into SSRIs or SNRIs right now, but I really feel like the future is different. The future is alternative mechanisms of action, because we need to find new ways to manage these symptoms without all the shitty side effects like weight gain, sleep disturbances, nausea, sexual side effects, all that stuff. Yeah, and lithium, because the other person mentioned that, lithium is always seen as like the gold standard for bipolar disorder. There are cleaner options out there. Lithium is something you have to kind of be very cognizant of your hydration level. You have to get your blood work done. It's something you need to monitor carefully. It also comes with some other side effects. I've had patients like start wetting the bed again or have other different issues with it. So if it works for you, it works. Ask all the questions when you talk to your medical provider who's ever prescribing this. But there are a ton of alternative treatments. Vagus nerve stimulator goes in kind of below your collarbone and it triggers your vagus nerve. And it's been incredibly helpful for a lot of people. One of my patients back in the day, again, acutely suicidal constantly. That was the only thing that would keep her out of the hospital. The basal or stellate ganglion block. I think I said basal, sorry, earlier. But stellate ganglion block, they find the stellate ganglion, it's like a nerve around here in our neck/chest, much larger and more pronounced, almost like a tree with roots in those of us with chronic or complex trauma. And this blocker shrinks that. And a lot of people will report after having that done, it's an injection like a lidocaine and something else injection, that they don't have any more hypervigilance. They don't have nightmares or night terrors anymore. So I'm always interested in alternatives. If you have one that's working for you, let us know in the comments. I think the more we talk about it, the more we're open to it, the better off we all will be. The safety is going to depend on you and your body and your situation. That's why we need to ask all questions. We need to let our doctor know all medications that we're on, things that we're worried about. We can read online any of the warnings. The one thing about pharmaceutical companies is they have these like black box or whatever warnings. And those black box warnings, I didn't realize this until I was a sales rep years and years and years ago. Black box warnings are class specific. So like if it's an antidepressant, it's going to have this certain warning attached to it. If it's an atypical, it's going to have these warnings attached to it, right? Those just follow the class of medication. It doesn't mean that that medication necessarily showed that also, but because it's in that same class, it comes with that warning. The stuff that I'm usually more interested in are the side effect profiles that come along with that medication and what they saw in their studies. That's what I'd encourage you to look into, because everything's different. Like certain medications, like, I don't know, let's see, I have had patients on Risperdal or different atypicals, and it causes them to like gain a lot of weight and they eat at night. Some of the men that I've treated in the hospital had, grew like kind of breast tissue as a result. That's a random side effect of atypical antipsychotics. And then there's things like Latuda, which has been incredibly beneficial and it doesn't cause as much weight gain. And my eating disorder patients always preferred it. But I'm not a doctor. So talk to your doctor, do all the research that you can. We have the internet, read about it and find something that feels safe and okay for you. However, I do have to say that these kinds of alternative medications, alternative treatments are incredibly exciting. The side effect profiles are so much cleaner. I'm really looking forward to the future of treatments because the side effects are what fucking sucks. And it's like, why should I trade? I'm not depressed, but I don't enjoy sex. I'm gaining weight and I just feel kind of blah all the time. Like, is that really better? I don't know, right? Sometimes it is if this is really bad, but I don't want us to have to trade like that. I'd like it to be like, I can do this. And then I feel, there's also great, and I feel better. Sorry, finish that thought, Katie. There's a great, I guess I'd call it a documentary on Netflix. It's How to Change Your Mind, I think is what it's called. Or no, This Is Your Mind on Plants, I think is his book. Anyway, it talks about these different, it's like I think he does peyote, MDMA, psilocybin. Anyway, he talks about all the treatments with these and the research being done. It's very fascinating. I encourage you to check it out. Okay. Moving on to question number 5. This question says, "Hi, Kati. I was wondering if your body could know that you are stressed or anxious before you realize it yourself. These symptoms come from the last few weeks because I've been having a lot of physical symptoms of stress and anxiety, but I don't usually feel more stressed than usual. I've been picking at my skin, especially on my face, which sucks. I've had acid reflux, which I've had acid reflux, which I should have because I take medication for it. Gotcha. I shouldn't have it. My stomach has been upset. I've been clenching my jaw and basically tense everywhere. I've had these periods of difficulty eating because I don't feel like it. And I can't decide on something, and then I'll try and I just end up crying. I'm also dealing with depression, getting more intense, but that's building slowly for much longer. And that now comes with intense irritability, outbursts of anger, usually when I'm alone, thank goodness. I know there's emotional stuff going on in me, and I get sad and upset a lot. I mean, probably more than normal, but I don't always feel the stress that is what this looks like. And I also don't know how to not be stressed. My job at the moment is constantly stressful, and I would appreciate any help and advice. I am working with a counselor at the moment. Thank you for everything." There's an add-on on this, but I may have pasted it the wrong spot. I'm not sure. But anyway, let me go through this, and then I'll just answer this add-on question. So our body will be aware of the stress and anxiety potentially before us, but that only happens if we're like disconnected. And what I mean by disconnected is like disconnected between brain and body, right? If I'm thinking a certain kind of way, but I don't feel it I like disconnect from my body, I numb out. Let's say a lot of my eating disorder patients have this where they won't feel hunger, fullness. They won't even feel pain in their body. It's like we're just disconnected from it. Therefore, I might think and feel overall like I'm really stressed or I'm really overwhelmed, but I wouldn't know that I'm experiencing it in my body because I'm disconnected from it. Now, in the reverse, the flip, you're talking about these physical symptoms that you're having, but you aren't acknowledging it yourself, which is incredibly common also, this disconnect, right? All this stuff is happening. It sounds like you have a very you're always kind of stressed, but it has ramped up for whatever reason, and we're kind of ignoring it. Maybe we're numbing out from it. Maybe we're distracting by keeping ourselves super, super busy. And so we don't technically want to feel it. And so it's showing up in our bodies. And it's very common because our bodies don't lie. And when we feel a certain emotion, just FYI, our nervous system / brain and body, they're working together, right? They're all connected. When we feel a certain emotion, that whatever chemical, let's say it's anger, then like norepinephrine is dumped into our bloodstream. And this is done as a way to help us to move through it or to do something, to take action, right? It can be part of our stress response, and we're being pushed into fight, flight. So that it's dumped. We feel that feeling. It runs through my bloodstream, and within 90 seconds, it has filtered it out. My system, my body technically has processed that emotion. However, our brain is on board also, and it doesn't just stop thinking about something. It often ruminates and it thinks back. And every time we think back to that thing that made us angry, our body feels that experience again, and it dumps that adrenaline or that norepinephrine into our system or whatever it is that we need, and we experience that emotion. Does that make sense? And so it's like we're having that experience, and we keep looking to that thing, and then we feel it in our bodies. All that being said, because of the disconnect between our brain and body, because we can numb out, because we can white knuckle it, we can push through, we can keep ourselves really busy and distract, we can experience things in our bodies and not even realize that they're happening. That's why a lot of people can have, it's almost like you described it exactly, like stomach issues, grinding our teeth, clenching our fists, soreness in our like neck and shoulders. Like how many of you are like, I'm that way. My neck and shoulders kill, or like lower back pain, or whatever. And we're like, but I'm fine. And you're like, no, you're not fine. You're just numbing out. You're distracted. You're not checking in with yourself to see how you actually feel. And so, yes, our body can know that we're stressed or anxious before we realize it ourselves. It's arguably more attuned, but we do everything in our power to often like ignore it or to numb out from it or to distract from it. And that. Unfortunately, that's normal, but that's not necessarily the healthiest. And so I encourage you to check in on your body, to maybe, I don't know if you're in therapy, but I would encourage you to get into therapy, because the outbursts of anger and the irritability, our resilience is incredibly low. It sounds like you're barely hanging on with stuff, right? Any little thing can set you off because You don't feel good. And so I might encourage you to focus on the basic needs, like showering regularly, eating regularly, drinking water, making sure you're getting enough sleep. And I know all of these things are easier said than done, but let's start with some of those basic things. Let's focus on that, have that be our homework so that we can at least feel, and treating any medical issue we have. If we have medicine we need to take it as prescribed, right? Avoiding alcohol and drugs for a while. We need to keep our head clear so we can figure out what's going on, be more attuned to this. Those are all some of the ways that I would encourage you to, get back in touch and take care of your brain and your body, because your body's telling you that a lot is going on and your brain is like, la, la, la. It doesn't want to hear it. And we have to reconnect that. We have to start learning how to listen. And it's uncomfortable, but arguably you're uncomfortable already, right? So we just want to make sure that we can become more aware so that we can apply the tools and resources when we need to. Okay. Now there was a comment on this, and I feel like maybe I pasted this from the wrong place, but I'm just going to read it and answer it because I think it went up. My guess would be that it would be up with question 3 when we talked about antidepressants and being on them for a long time. Because it says, and what about brain chemistry? Has it changed forever with so many years with antidepressants or what? Right? See, I think I copy and pasted it wrong. I'm so sorry. But the brain chemistry itself does change because we're altering it by way of the medication, right? It's grabbing all the dopamine or all the serotonin. It's trying to put it where it needs to go. It's maybe suppressing another type of hormone or chemical in our brain so that the other one is stronger, right? It's modulating. They call it like modulating the receptors, modulating the amount of, dopamine, serotonin, norepinephrine, whatever it might be. So technically it does change your brain chemistry. And that's I would assume any neuroscientist out there, again, I'm not a neuroscientist, but they would probably say, well, that's just like a very generic way of talking about it because it's more specific than that. But it definitely is changing it. Now, I don't believe it's changed forever because once we remove that medication and that whatever it was doing is not doing it anymore, that it could over time go back to the way that it was before. I don't believe that it's changed forever, like it's altered our brain. Now, I haven't seen brain scans of people who've been on medication for a long, long, long time and how it has changed over time. And if they go off, does it revert? I do not know that, but I'm sure you could probably try to look that up. There's not a ton of brain scan stuff. There is for depression, anxiety. You can actually see it in the brain, which is wild. But I would believe based on what we know that yes, it does change the brain chemistry when it's working, when we're taking it. And then when we go off of it, it will slowly revert back. Okay. Moving on to question number 6, it says, hey, Kati, I was wondering if you could talk about post-traumatic growth. How do I recover from PTSD after years of trauma, abuse, and neglect? Now, post-traumatic growth is fascinating, and it's very hopeful. What post-traumatic growth is essentially the belief that we are a anti-fragile system as people, meaning that when we are put under strain or stress, we don't just go back to baseline. We actually rebound and get stronger, smarter, faster, better. Like a good example of our anti-fragile system is that when we get a vaccine, it gives our body a little bit of that virus or that bacteria or whatever. And then our body gets stronger. It recognizes that virus or bacteria. And then if we encounter it in our life later, it's like, hey, I remember you, and it can deal with it. So it gained intelligence and strength. It got bigger after we gave ourselves a little bit of it. And sometimes when you get a flu shot or something like that, you can feel sick for a little bit, right? It's almost like it takes you down, but then we grow back. Or another good example of our anti-fragile system is when you go to the gym and you lift weights, your muscle pulls against your bone. And not only does it strengthen your bone, because our bones like to have a little bit of pull to them, be a little bit challenged, right? They like that, I don't know, not necessarily, I don't want to call it a trauma, but they like to be roughed up a little. And so do our muscles, right? We tear them and they build bigger and stronger. So our system as a whole is an anti-fragile one. Therefore, when we encounter a trauma, when we encounter something that happens, it wounds us. It's like we pulled on that, or we maybe ripped those muscles, then we grow back bigger and stronger. And there's a ton of research being done in post-traumatic growth right now. There's actually I worked with the company called Choose Growth. You can look them up. They talk a lot about it. This essentially means that even though bad things have happened to us, we can rebound bigger, stronger, better than ever. Now, that takes some work. It takes us acknowledging that what happened was trauma. It takes some tools and techniques and support, right, to get through it. Because I know at first it can feel, right? If I ripped the muscles at first, it's painful. I can be super sore. I really overdid it. This muscle's so sore. It takes it a while to grow back. And so I know a lot of us can be in that phase where we're like, oh, this is so painful. The trauma that I sustained was terrible. But as we work to heal, we'll bounce back better. And the reason I believe that we will bounce back better is because not only is our emotional intelligence deeper, but we also have proven to ourselves that we can survive. We can do hard things. Who is it that, is it Glennon Doyle that always says I can do hard things? But we can do hard things. We can survive tough times. We've kind of proven to our system and to ourselves that we are greater than that we are stronger than that we are bigger than that. And it deepens our feelings of the world and ourselves and our understanding of the world and ourselves. There's so many more layers to us as a result. And so that's really the idea behind post-traumatic growth. That's what we know. And we actually see it like from a cellular level. And there's a lot of like research about that. That's why I'm like, we are an anti-fragile system. But I believe that that's what can happen. That's why we can overcome trauma. That's why we can heal. But we just have to get ourselves to the place where we have worked through the pain. We've allowed the healing to happen. Like I said, that muscle can be really sore, but then when it grows back stronger. And if we keep working at it, if we keep challenging it, it will continue to grow stronger. Does that make sense? I hope so. Thank you all so much for listening and watching. Thank you for sharing this podcast. Thank you for your great questions. Sorry that I pasted that one oddly. I don't know what happened. It's Monday when I'm recording this, so maybe I'm just not quite with it. But I love you all. Take care of yourselves. Do your homework, and I'll see you next time. I'm all done, honey. I don't know what happened. I think I pasted a add-on question.